I'm here today to speak about how I use video in my PhD research. What I was most interested in finding out is how older people understand healthcare information that's communicated by a nurse. My focus of this study is actually one teaching encounter, so one interaction between a specialist nurse and an older person with chronic disease. The key thing is really how the patients responded to seeing themselves in a video recording of this interaction with the nurse. I wanted to really find out firsthand from the patient how they understood the nurse and how they could relate to them as a communicator of healthcare information. So what I did was I showed the patient the footage of themselves in the interaction with the nurse, and whilst they were looking at the video I asked them questions. And I could find out if they understood the healthcare information, and I could also find out what enabled this learning. As I did this, I video recorded myself and the patient looking at that video recording. Then this was shown to the nurse. The nurse could then see firsthand how the patient experienced their communication and could actually consider how to customise the delivery of healthcare information to suit older people. Using video reflexivity is incredibly powerful because people can see themselves in a video recording. This actually allows them to revisit that experience and to speak more fully about it. I wanted to find out about the patient's experience, but also find out how important it is for our healthcare information to be customised to the individual. We need to make sure that older people understand the healthcare information so they can manage their chronic diseases more effectively.